Hi, I'm Alan Bienstock. I'm a board-certified plastic and reconstructive surgeon. My expertise is wound care for those that are homebound and bedbound. We've done many videos talking about general topics with a question to begin with. Now we're doing a session of live patient interaction, meaning I'm actually going to the patient's home and doing the wound care. I'm giving you a little introduction to the patient. The patient is an 88-year-old female that you're going to see who has a history of heart failure, edema, which is swelling all over the body, particularly the legs. She had a fall, which made her significantly weaker. She's not been able to ambulate as well. She's able to walk with what's called a walker. Due to the trauma in the springtime, she developed non-healing wounds at both the right ankle as well as the left heel. We've been contending with this for the past few months. When I first came in, it was infected. There was dead tissue. I performed multiple surgical debridements or cutting out all with devitalizer dead tissue. I had to put the patient on antibiotics. One of the struggles I initially had was dealing with different nurses. There was an agency that provided nursing care for the wound care, but it was very inconsistent. You had a different nurse on Monday versus Wednesday versus Friday, and that is not a recipe for success. Anything in life, whether you're in business, sports, you need to have consistency. So we had different nurses. So I discussed this with family who did have resources. They wanted to get rid of the agency since they weren't providing consistent nurses. We got a private nurse involved who was doing the wound care the days that I wasn't there. We did daily wound care. The most important thing was doing the right dressings as keeping the legs elevated because she had so much swelling in her legs, what we call edema. It was impairing the wound from healing. So we did appropriate wound care. We used Santal, which is a collagenous, which debrides any residual slough or devitalized tissue. I used hydrophora blue to get rid of the additional slough as well as minimize the drainage. Hydrophora blue is great for sucking up fluid or exudate where there's bacteria. We did this on both wounds. Once again, like all other wounds I've taken care of, I've had to do multiple debridements. We did have to do that. Unfortunately, she did have a course of cellulitis of the legs, which is unclear what caused it. The patient almost was bacteremic, meaning the patient had most likely the infection in her bloodstream. She was acting a little bit loopy or had a little bit altered mental status. A lot of physicians in this scenario would send the patient to the hospital, but the family refused this. We were able to get a team in to do IV antibiotics. We put the patient on IV vancomycin for a few days and then switched her to Zyvox, which is an oral version of vancomycin. The cellulitis went away significantly, and we were able to avoid a hospital visit, which is a very big deal because most patients don't do well even for a 3-day hospital visit. So this patient was able to do the wound care in the house as well as do intravenous antibiotics. 2 weeks after the antibiotics were finished, she developed a dermatitis or most likely allergic reaction. That was very difficult to diagnose. The nurse originally thought it was another cellulitis. I saw the pictures, and based on the patient history, it seemed like a classic dermatitis. I did a short course for 1 to 2 weeks of hydrocortisone. I put the patient on Benadryl as well as Allegro, which is a medication we use for allergies, but is appropriate for an allergic reaction. This resolved very quickly. Right now, you're going to see me doing the wound care. We've switched away from using hydrophora blue since the wound is draining very little. It's very clean. There's no slough. We're using a dermal tissue product to go in the wound. It's basically like a wafer. We put that in the wound with gauze. We wrap it with Curlex, and you'll see something. It almost looks like a plastic. It's called Coban that helps compress leg, meaning helps squeeze all that fluid back to the heart and minimizes any edema. I would love any of your opinions or suggestions below. We've made a lot of progress on this patient. Please subscribe to the channel when you get a chance, share it with your friends, and make sure you watch the next video of me interacting with the patient. I look forward to our next session. Thank you so much.